Good afternoon, everyone, and welcome. Thank you so much for joining us. We are delighted to have you here in the third part of our webinar series, Increasing Access to COVID-19 Vaccines Among Homeless Populations, Successful Partnerships Series. Today, we will be featuring some wonderful partners in Chicago, Illinois. Just a few reminders and acknowledgements. This webinar is supported by HRSA. However, that does not necessarily represent their views. And we are fortunate enough to have some exceptional experts here from the Chicago community. And those presenters, their presentations are solely their own. Today we have with us Luana Johnson. She is a bachelor's in behavioral science. She is the director of shelter operations at Franciscan Outreach. Christine Riley. She has a master's in divinity. She's the director of homeless prevention, policy, and planning for the Department of Family and Support Services in the city of Chicago. And Dr. Thomas Huggett, who also has an MPH, is a family practice physician at Lawndale Christian Health Center in Chicago. And Mary Tornabetti. She is a shelter-based project manager at Heartland Alliance Health. She is also the chair of the Council's Clinician Network Steering Committee. And I am Katie Leek. I am the COVID-19 project manager for the Council. We've got some wonderful things that will be happening today. We look forward to the conversation with you all. I'm going to start by learning about the collaboration within the city of Chicago that fosters innovative and timely responses to meeting the needs of people experiencing homelessness during the pandemic. We hope you'll gain an understanding of the collaborative relationship from the perspective of a shelter provider, explore the shielding hotel intervention implemented early in the pandemic and its impact, discuss their vaccine ambassadors and vaccine engagement, learn about innovative conversations to consider homeless service provision in a post-pandemic world. And of course, we hope to be able to address as many of your questions as possible. So please feel free to put those in the chat as we go along. And at the end, we will open it up to our panelists. So without further ado, I'm going to turn it over to Luana.
Hi, yes, I am Luana Johnson. I am the Director of Shelter Operations with Franciscan Outreach. And as Katie mentioned, I'm pretty much just going to talk about how we got the boots running on the ground with shelter vaccinations. And so early in the pandemic, it pretty much started with a collaborative relationship through a group that we now call CHARGE, which is the Chicago Homelessness and Health Response Group for Equity. And this group is pretty much comprised of like medical student leadership, healthcare and homeless service providers, the city of Chicago, the Illinois Department of Public Health, and a lot of other providers. Early in the pandemic, we all came together and provided guidance as a collective. And so it was not like an isolated idea, like we're gonna do this, you're gonna do that. We all came together as a collaborative to come up with guidance. And so early on, like I mentioned in the pandemic, they advocated for shelter staff and guests to be prioritized for the vaccine. We also sent out letters to the Chicago Department of Public Health and the Illinois Department of Public Health to include outreach workers and drop-in center staff. Franciscan Outreach, we pretty much operate 3 shelters in the city of Chicago. And as mentioned, we are one of the largest providers of homeless services in the city of Chicago. This picture that you see pretty much represents our Franciscan Outreach shelter location before the pandemic. And so before the pandemic, the House of Mary and Joseph, we had 271 bed facility. We have an annex center, 70 bed facility. Both of these locations pretty much take in single women and single men who are in need of shelter on a daily basis. We also operate a Casa Pilsen project, And that project is a little different. It is a low barrier facility, and we pretty much work in collaboration with the city of Chicago, and we take in encampment individuals. And so again, early on in the pandemic, as a collaborative, we started decompressing our programs. And so this top picture you see is after the pandemic, and we pretty much pulled out all of the beds, all of the old beds, and we replaced them with new beds because we wanted to make sure that none of the beds that were on the premises was carrying the virus. And then we incorporated new beds, and then we also incorporated some partitions. And so that way we were able to pretty much start what we consider a cohorting, where we had groups of people who were smoking like cigarette breaks and feeding breaks and things of that nature. And so if somebody contracted the virus, that we can immediately test that group and get them what they needed to safety as it relates to the virus. And so we started working, the charge group, we started working with what we call ShelterBased, I'm sorry, I'm a little nervous. Please forgive me. What we call the service-based shelter team. And so we were assigned some providers, like Lawndale Christian Health Center was given to Franciscan Outreach. And so they just started like early discussions of the vaccine with our guests and staff. Lawndale Christian Health Center provided informationals and posters about the vaccine and possible side effects. As I mentioned, Lawndale Christian Health Center is the provider, our shelter-based service team. And early on, they started with what they call All About the Vaccine for staff that address questions and hesitancy. And what impressed me most about this is they were able to answer questions like systemic Black trust issue questions. And they were very transparent in this process. And any questions that they were not able to answer at the time, they immediately found the answer. They consulted with CDC guidelines and the Illinois Department of Public Health, and they were able to get that information back to us in a timely manner. They also came on the premises and spearheaded small groups our shelter guests with our shelter guests, and they conducted these meetings in a safe space, and they were able to, like I mentioned, with the shelter staff, the questions that were asked, they were able to answer the questions. They were transparent, they were patient, and it really helped in encouraging some of our guests to receive vaccinations. With this process, what was most impressive about them speaking to our guests is that it did not come off like they were trying to change their mind about the vaccine, but to pretty much give education as it relates to the purpose of the vaccine, how it can help us and get us back to normalcy. And that was really helpful in the process. And so Lawndale Christian Health Center, they started vaccinating across all of our programs. Again, I mentioned that we do operate 3 shelters in the city of Chicago. And so with that, it kind of increased accessibility. There's actually an encampment right in front of one of our shelter locations, and they opened up the vaccinations to the encampment population. And again, they just immediately started vaccinations events across all of our facilities. They posted vaccination testimonials, which was really great. When I received my vaccination, they took a picture of me, and I was able to write down and say, hey, this is why I got the vaccination, because I want to keep each of you guys safe, because I'm not exempt from contracting COVID-19. And so if I'm vaccinated and you're vaccinated and we're all vaccinated, you know, this would help, we would help each other out. And again, just those postings and those testimonials, some of the people who initially was like, no, I'm not gonna get it, they're just trying to kill us off. A lot of those people eventually got in line, like, hey, vaccinate me. You know, like as the leader, if she's okay with taking a vaccination, I should be okay with it. And so it was really helpful in that process. And again, just working in collaboration with the charge group and the shelter-based team, it was really helpful in implementing and getting a vaccination out to our guests. And they were vaccinated early, and it was really positive because the charge group are the ones who advocated for shelter guests and shelter staff to be included as outreach workers. And it was really helpful for us. And so I'm going to pass it along to Christine Riley.
Hello, everybody. Again, thank you so much. I want to first say that working with these group of people that I'm on a panel with has been awesome. We've shared with Katie before that we're like a family, and I do believe it. It has been a wonderful experience working with everyone, all of the providers around this pandemic. And we do believe that we truly have made a difference in Chicago. So just from the city side, the City of Chicago Department of Family and Support Services, we are considered the social services department for the City of Chicago. Our department, just a little bit about our department, we fund agencies to provide direct services to residents of Chicago. We have children's services, youth services, senior services, workforce services, domestic violence. So we are a whole lot of divisions doing great work. So in the beginning of this pandemic, as you can, all of your agencies had to kind of scramble and see how working from home would be. We had the task of working with the Chicago Department of Public Health and figuring out how we can decompress our shelters. Lawana talked about their experience of decompression, but we had to figure out a way, okay, we have to decompress, we have to follow guidelines about 6 feet distancing and make sure everybody is socially distanced. So we had to figure out a plan in order to create new spaces. We started with weekly webinars, and our first weekly webinar with our shelter providers, because we wanted to be very transparent. We wanted to make sure they had all the information that they needed. Our first webinar was on March 13th, and this was with all of our delegates. For the shelter decompression, we needed to get especially the residents out of the larger congregate facilities. As you can tell, Luana, she has one of the largest homeless agencies in Chicago. So that was our main focus. Our efforts with the city was 7 days a week. It was a remarkable effort on the city's side because we were able to pull together different departments. Our Office of Emergency Management and Communications, who oversees all the emergencies and coordination, they pull the Department of Housing together. Our Department of Assets and Information, who works with facilities, they pulled in CPS, Salvation Army, American Red Cross in order to do this. Along with the conversations with charge, because there was another component that Tom and Mary made mention is the isolation facility that we had to set up. I was able to go on site visits to select different sites who would do isolation. We were wanted to make sure initially that our agencies got some kind of PPE. The United Center during the summer, which has our Bulls basketball team, it was actually our donation hub. So every other week, agencies were able to go to the United Center to get masks, to get cleaning supplies if it was available. But we wanted to enhance sanitizer. We wanted to make sure that everybody had what they need initially. And as we all know, even from our personal lives, it was really hard to get cleaning supplies, even in the grocery stores. There was a backlog. So we had to do what we could in order to get this going. We were able to set up, and I'm telling you the truth, within 5 days, we set up 3 alternate shelter locations within 5 days at the end of March. And we were in YMCAs, Luana and Franciscan. We are so grateful. They were able to take some of their staff to the YMCA, and we were able to place 200 men at that location. And we were in Salvation Army buildings. We were able to service different populations, those exiting the justice system, coming back. So it was like, initially we had 400 beds made up of single men, youth, and returning citizens. And like I said, later, I know Dr. Huggett will be speaking on it. Our most vulnerable residents who are at the higher risk of COVID, 65 and older with underlying medical conditions, were identified and were put into a shielding hotel. And this was very good in the beginning. Also, we had to change the way our shelter referral system worked. We also fund the agency who manages our shelter clearinghouse. At the time, all shelter, if you wanted to be picked up for shelter, you can go to any hospital and any police station, and they will allow you to wait and call for a shelter. And then the agency that we funded, they would come and pick you up and place you. Because of COVID and the pandemic, hospitals and police stations were not letting outsiders come in. So at that time, we had to change our referral process where people can call from anywhere in the city of Chicago. And that's still how it is now, anywhere in the city, and then the agency would pick them up. So that was a change. In the beginning, our COVID-19 health screeners were approved by and created by the Chicago Department of Public Health. We were able to send all of that out to all of our delegates. And also with outreach, outreach teams were assigned to different areas, because it's not only shelter, but the unsheltered. And they were able to scan the city to find where homeless people were, making sure they had the correct PPE, make sure they had education, as much education as possible on the virus. And they conducted the health screeners as well and passed out hand sanitizer. And they would report back daily. With outreach coordination, we wanted to make sure that those larger encampments that Luana mentioned were taken care of. So encampments that had 10 or more people, that usually depended on restaurants, as well as Park District facilities, which were now closed for their, washing their hands, going to the restroom. They no longer had that access. So we were able to place porta toilets in those locations, as well as hand washing stations. And now we have hand sanitizer stations at these different locations. So that really helped our unsheltered population, because still, as you know, some people may not be willing to go into shelter. So we wanted to make sure they were taken care of. And also with the expanded outreach, we wanted to make sure those on the CTA were taken care of. We had additional teams engaging residents on CTA platforms multiple times a week, as well as at our major airport. And you can go to the next slide. Thank you. So our mitigation goal was to develop a citywide system to prevent transmission of COVID-19 and within congregate settings, and provide compassionate care for people experiencing homelessness. Again, we constantly gave guidance around social distancing and infection control, and we really collaborated with healthcare providers. I tell people, I think I'm on the phone with Tom and Mary probably 3 or 4 times a week, and Luana, because we have our charge calls. But it's really great to see this collaboration. And the goal was to prevent, identify, and then respond. Next slide, please. So to wrap up, I wanted to just state some of the things that are happening now that's come out of this. As Luana mentioned, the Chicago Department of Public Health was able to fund 2 lead coordinating agencies, which are Lawndale Christian Health, as well as Heartland Alliance Health, to provide and coordinate health services to each of our shelters in the city through their shelter-based service teams. The city, we made investing in housing a priority, which led to us funding $35 million for the Expedited Housing Initiative to support those who've been impacted. And this has, this week, we reached over 500 and I believe 30 people being housed since the summer, early fall, which is amazing. And this has eliminated a lot of the barriers that are usually taking place. They have totally worked with landlords. They've been working with housing providers to get documentation. Accelerated moving events for sheltered and the unsheltered has been created. And because of this, for the Expedited Housing Initiative to take place, we actually had to change our coordinated entry system prioritization. If you're familiar with the continuum of cares throughout the country, every continuum of care, which is our homeless response system, has to have a coordinated entry system. We had to get a temporary change in prioritization in place so that we can focus on those who were most vulnerable in regards to and impacted with COVID-19. So that was very good. So again, the creation of our healthcare partners, currently we have 2 remaining alternate shelter locations. 200 men are in a hotel right now, 200 women are in a school that we set up shelters, as well as our overnight shelters who were only running 12 to 15 hours a day overnight. They're now operating 24/7 because we felt that that was a safer place for them to be during this pandemic. They weren't fed in the morning and then released to the streets. We wanted them to make sure they had a place during the day to stay. And also we've seen an impact, especially in our youth system, that's they're really happy with the 24/7 because it provides more stability for our youth, our homeless youth. They're able to get jobs. And I know even in the adult overnight shelter system, more case management is being participated in. So we're very grateful for that. And again, now instead of weekly webinars, we have monthly webinars, and our partners are with All Chicago, who's our lead entity with our COC, as well as the Chicago Department of Public Health. So we're very grateful for these partnerships and for, like I said, for the people on this panel, and we look forward to continue partnerships and collaboration. And now I'm going to toss it over to Dr. Tom Huggett.
Thank you, Christine. And I'll reinforce the feeling of family. I've worked with Luana for the last 20 years, and Christine and I go to the same church, actually. And I've worked with Mary Tarnabeni, though at different agencies for the last 25 years. So this pandemic has really brought a lot of us together. What I'd like to do in this part is really talk about just four things, really look at some of the statistics regarding coronavirus positivity rates in Chicago. We'll talk about the protective housing response at the hotel that Luana and Christine both mentioned. We'll look at the city relationships, which have been really key to this collaboration. And then before I turn it over to Mary Tarnabeni, look at the vaccine coverage rates regarding people experiencing homelessness and how the collaboration really has helped this. So the next slide shows the SARS-CoV-2 test positivity results, the coronavirus test positivity results. And you can see that the blue line shows a huge spike in April compared to the orange line, which is the general population in Chicago. And we can also see the spike also in November and a smaller spike in January of this year. The next slide shows similar data, but this actually shows the number of cases. We've had 626 people experiencing homelessness with a coronavirus infection. And you can see that again, April, we had over 200 cases in April, and it was really pretty alarming. I think we've had, as far as I know, 2 people experiencing homelessness die of coronavirus in Chicago, one in early March and one during the November surge. The next slide shows, it's really a slide to really thank our testing partners, the collaboration that we've had with the University of Illinois, Rush University, and Leary Children's really helped to do a lot of the testing at our shelter sites. These were large teams of 8 to 10 people that would go into shelters and to our hotel to do point prevalence surveys. And you can see that in April, point prevalence for people experiencing homelessness was 38%. However, in some of our large shelter sites, it was upwards of 65%. So it was, it was really, as we all kind of experienced, pretty intense in April. You can see a small little blip again in that November, where 6% were positive. I remember there was 42 out of 142 were positive on one day. We remember that day very well because we had to, of course, you always find the results on Friday afternoon, and we had to go to that particular shelter location and do rounds on those patients to find out how sick they actually were. Because of the data collection that we've been able to do in collaboration with the city, which has been really great to work with Chicago Department of Public Health, Department of Family and Support Services that Christine is involved with, and really experts from Atlanta and the CDC that have been embedded with the city, we were able to show data that shelters like large congregate shelters like shown in the upper left pictures really had more coronavirus. I mean, it's pretty obvious, but by working with the city collaboratively and doing the data, the prevalence ratio was 1.76. In other words, is 1.76 higher risk of coronavirus if you're in a shelter that had more than 20 beds. These data would be really helpful in driving policy. And I think that collaborative work really helped as we move forward. This really drove the policy that you will see in the next slide, which was one of the interventions that Luana and Christine mentioned, which was having a hotel in downtown Chicago provide protective housing. And this happened extremely, extremely quickly. You can see in the upper left photo, kind of the crowding of the shelter and also some of the students and other folks who were doing screening for symptoms at that point. But what we realized that isolation of people who were symptomatic was not enough. And what we really needed to do was protectively shield people who are high risk, as was stated, people who are over the age of 60 or over the age of 55 with hypertension, diabetes, lung problems, or obesity. We, in the course of that, from April 2nd to September 3rd, in those 5 months, we shielded 259 people. And the rapidity cannot be overemphasized, as Christine said. We had to act very quickly. We had 92 admissions to the hotel in the first week. So it was really a very rapid, really rapid response. And you can see the picture of the hotel just off the Magnificent Mile off of Michigan Avenue in downtown Chicago on the right-hand side of the photo. And this really leads to what the next slide really is emphasizing. What this whole talk is about is how the collaboration and building relationships with our city leadership was so very important for us as healthcare providers who have been working with and providing healthcare for people experiencing homelessness for years. We were really able to bring it to another level by working with our city partners in the Department of Public Health, by appearing at press conferences with Mayor Lightfoot, by appearing in press conferences, as you see with Mayor Turnabeni in the center in the lower picture with Commissioner Arwady, by really working with Deputy Commissioner McCauley and Christine Riley, and with the CDC EIS officer, Dr. Ganai, was so in the lower right, was so important to make that collaboration, along with our housing partners, shelter partners, and so many other advocacy partners that were so important in pulling this off. And what we found at the hotel in the next slide is that we did have success in the shielding hotel. Initially, we had quite a few people that were just being isolated, and then we kind of shifted to the shielding model about a week later. But we had to do daily checks in the hotel by doing temperature checks and O2 sats, and some of the folks were really pretty sick. 66 had COVID-19 disease. Many of those went to an isolation facility that was outside of this hotel, but 9 were transferred 2 blocks away to Northwestern Memorial. 8 ended up in the intensive care. 6 were intubated, but none, we are happy to say, died. So we do feel like the hotel was important in the initial isolation for folks who had coronavirus, but also we have evidence that we actually shielded them from getting coronavirus. The other major outcome from the hotel was that the majority of the folks who were at the hotel really, they went to housing. So more than half went to permanent supportive housing or rapid rehousing through the expedited housing initiative that Christine outlined before. So this was also a very big collaborative effort with our housing partners at All Chicago and who are with the continuum of care. We really learned how to do these accelerated moving events as we were talking about. Only 10% actually self-discharged. The other folks either went to a residential recovery program or to isolation facility because they're coronavirus positive, or had hospital complications that were not coronavirus related, such as mental illness and other issues, medical issues. At the same time, I do have to say, is at the same time we were doing the hotel project, we were still working with Luana and all of our other shelter partners in the shelters, doing the infection control, making sure that they had hand sanitizers, plexiglass, HEPA filters, and doing the education sessions to make sure that infection control was going on. And in the next slide, I would like to just say this slide, I really love this slide because on the bottom, I don't know if you can see it all, but we have the logos of DFSS, All Chicago, and CDPH. And what that means is that all of these were coming together along with us as healthcare providers to see how we could help people to achieve the housing that they really deserve. So the accelerated moving event really, we were able to start at the hotel. There have been 24 accelerated moving events since, as Christine said, and almost 450 people have moved into housing in Chicago. And what is our role as healthcare providers? Well, what we've been working with now is we are kind of doing assessments before these accelerating moving events to see what kind of supports folks need to be successful in their housing. Some folks with serious mental illness, for example, they may need EACT or CST. Some people cannot go upstairs. They may need an elevator building, for example. Some people need other assistance, such as IDs. So that's what our role has been, and we've been kind of developing this role. And one of the silver linings of this pandemic is to see how we can all coordinate together: healthcare, behavioral health, opioid treatment programs such as methadone clinics, housing, city departments, how we can all move together to see how we can help to support people who are experiencing homelessness to get them into housing. My last 2 slides really look at a couple of different things. This is looking at vaccine coverage rates for the city of Chicago. This is from, I was telling our folks, the city has been so great with data. Shout out to Mary Kate that I wanted to update this slide. So now actually in the city of Chicago, it's 28.5% are completed the coronavirus vaccine series, 28.5%. But on the next slide, we are so grateful to the city because the coverage rate for people experiencing homelessness is 52%. 52%. So we are so grateful to the city of Chicago and folks for prioritizing folks experiencing homelessness to receive coronavirus vaccines starting on January 26th of this year. We still have a ways to go. We want to get that coverage rate up even higher, but we really want to, we really appreciate the collaboration. About 3/4 of the vaccines have gone to Black or other people of color, and 3/4 have also going to people experiencing homelessness, the other quarter going to staff. We've given over 5,400 shots to guests and staff between Lawndale and Heartland Alliance Health. Speaking of Heartland Alliance Health, I am very pleased to hand it over to my colleague, Mary Tarnabeni, or I should say Chair Tarnabeni.
Thank you, Tom, and thank you everyone for being here today. It's an honor to be able to present to you with my work family. Over the course of the pandemic and even before, Heartland Alliance Health has been steadily increasing our work in shelters. And we've also been at the same table with our shelter partners this past year, with hospitals, with medical and nursing schools, and the Chicago Departments of Public Health and Family and Social Services through CHARGE, as you have heard. This collaboration has really been life-saving. They have impacted vaccination in really amazing and positive ways. When we have had challenges in engaging participants, and our partners at the city and in CHARGE work before us and beside us, offering support not only to our vaccine teams, but to the shelter staff and residents as well. Across health agencies, both Lawndale Christian Health Center and Heartland Alliance Health collaborate at least twice weekly. We want to ensure that our response is equitable, that we provide support to each other and consistency to what we do for staff. I want to address some of the how we've been working to engage participants. We work with our participants and shelter partners in really numerous ways. Initially, as you heard, the Department of Family and Support Services and the Chicago Department of Public Health, they have routine weekly webinars, which are now monthly, but they were also on through those webinars discussing vaccination, telling our shelter partners that vaccine was coming. Both lead coordinating agencies invited shelter partners to virtual meetings where we listened, we discussed vaccine science and logistics, we answered questions. And then using an equity lens and guidance from the health department, we deployed our teams to engage frontline staff and participants in shelters. We started with the shelters that had been most impacted by COVID-19 and those in communities with high rates of disease. First, we sent our outreach teams, our community health workers, and we followed or accompanied them with our nursing staff. We listened, we offered one-on-one and small group engagement on site. Our administration team kept in frequent contact with shelter managers, answering questions and listening, but most importantly, listening. Our healthcare providers engaged at each visit with participants. These efforts were also occurring simultaneously with ongoing vaccination in one spot and engagement in another. And we repeated some of these efforts in our shelters before our second rounds of Moderna. Actually, you can move a slide ahead. When the first round uptake in a shelter was small, we went back with engagement staff to increase rates on round 2. And I want to give a special shout out to our community health workers and our prosumers. They work to share their vaccine stories, their vaccine hesitancy, and to acknowledge past experiences. They stood beside our participants and they held hands when needed. They added a lot of peace and a lot of richness to the experience, and they added a lot of confidence in our work to our shelter partners and participants. Next slide, please. Some of the other reasons that I think we've been very successful is we worked together to make these events joyful. We wanted to make them consistent with what people were seeing on social media. So both Lawndale and Heartland had buttons and stickers and bracelets and Polaroid cameras for photos, My Why sheets. And one of our shelter partners actually had several COVID-19 piñatas for participants to hit. We had done a more assertive push to shelters we have partnered with for less time and sites that were new to us. We felt that our established sites would have more uptake in vaccine. And for most sites, that was actually true initially, but it wasn't universally. One of our newest sites had 100% uptake of their 33 participants, and some of our established sites had only 1 or 2 initially, but all of the sites that had less uptake initially, we have been steadily increasing that. We've also been providing vaccination along with the Chicago Department of Public Health and mobile outreach van. As of April 26th, the doctor on the van has administered approximately 430 vaccines. The unsheltered homeless population that they serve has been quite receptive to vaccination, and the preliminary data shows that vaccine completion has equaled or exceeded the national average. The evidence anecdotally showed that persons who are street homeless did not have significant reluctance to COVID-19 vaccine. And the overall attitude of the unsheltered population that we serve has been really positive. Our vaccinees receive a waterproof heavyweight small Ziploc bag. It's a 4 ml bag, 4 inches by 6 inches. And we put their vaccination card in it. We also put a card for phone numbers to our clinic. Really important, especially to people who are street homeless, so that they can call us if they miss the van when it comes around the next time. And a lot of people haven't been able to come to our health centers to get their second vaccine if they have missed the van. There's really been a high percentage of paperwork actually being kept with those little 4 ml bags as well. The principal challenges of the vaccine efforts when it comes to our mobile outreach has really been logistical, with the paperwork and making sure that everybody is aware of the schedules. There's a lot of phone calls to people who have very little access to charge their phones. The population served by the mobile van is widely scattered, and we have really been operating a concierge vaccine practice, going to day labor sites and job sites and encampments and mass transit terminals and city streets. And if we can get a hold of somebody and they're working at a job site, they're going to go. The city partners and the mobile van team have really found this work really gratifying. They're really excited, and they wanted to make sure that I thanked the city for their ability and their support in allowing them to do this work. Some of the biggest challenges, though, that we've had in both shelters and in the mobile van are the end of day dosing. It is exhausting. At first, it was a little easy. That we had a shelter in the same building as one of our clinics, so we could go back and vaccinate there. We also have 2 shelters that we could vaccinate. Over time, we completed the first round of vaccines in those sites, and they also wanted events. They wanted to celebrate, and we accommodated them, of course. But our shelter-based service team then went to work with our health centers and to find persons who are homeless to vaccinate. But it really is a challenge, and I know you probably are all experiencing the same. Those end of day doses are really difficult. I'm really proud of our team. We have not wasted any doses. And a few times we have been out yelling on street corners on Saturday at 5 o'clock, hey, do you want a COVID vaccine? People look at us like we're a little crazy, but I'm like, no, it's really legitimate. We talk with them. But we have been able to give all of our doses, and which to me is pretty remarkable. What I really need, and I know what you all need too, is either a 24-hour vial or a single dose vial. My boss, Ed Stellan, often says that vaccines move at the speed of trust, and individually that is very true. One of our goals was to have participant vaccine champions or work with us. And we have a few that push efforts out, but honestly, vaccines, this effort, it really moved at the speed of light. And I really like the time to make that program work as much as I wanted to. But as we approach this next phase of vaccination, we're really looking at that again and how to make it work, how to really get over the people, the hesitancy for people. So we have 2 models that we looked at. I think I'm actually a slide ahead. For the past 3 months, vaccination has dominated our daily work lives. We've done some work in the shelters, but really it's been vaccine. We looked at a model that would incorporate our shelter-based service teams to bring vaccine every time they go out. Maybe they would do Janssen on site and we would schedule Moderna in our clinics. But in the end, I think my team is tired and grateful to have had to be able to still provide vaccine. But so to preserve my staff and their sanity, we've decided to go to use the second model, which is a twice weekly RN team. Let's do vaccine rounds. We're able to get to every shelter at least once a month. Our regular healthcare teams go out to the sites as well in between those visits. And if somebody wants a vaccine before the vaccine team would be out, we will schedule them in our clinic. We will break down any barrier that we have to make sure that a person gets their vaccine. But I also want to be able to support my staff. And with that, I turn it back over to Katie.
Thank you so much to everyone. I am just absolutely in awe of the work that you do, and I cannot reaffirm enough the family feel. When I brought this group together at first, it was amazing to really feel like I was sitting at a table with family and hearing about all the work that they've done in the past 14 months. And I feel like that data in particular shows what could have happened when you look at that spike in April, and then really feel like their interventions have impacted or caused the trajectory that they are on, and that lives, nothing short of lives, were saved because of that. So I will certainly welcome you all to ask any questions in the chat box. But one question that we have is, has Chicago used any model of a vaccine ambassador, particularly utilizing individuals with lived experience I know, Mary, we've talked about this, so maybe start with you, but if anybody else would like to chime in, please do.
So I really wanted to, and I actually had a plan all worked out to do it, but it, this moves so quickly that really I ended up losing sight of it, to be very honest. But we are actually talking about bringing it back again, because we're at 52%, which is fabulous, but we want to get to 70 to 100. And I think that is going to be one effort that we're really going to push in the next month to increase our numbers. The one site that we had that it did work quite well on, we were up to 66. That was one of our suburban sites, 66% vaccinated. So I know it will work. It just, now it's time to implement.
I think I could say that there are a couple of things on the vaccine ambassador thing. One is kind of what Luana mentioned, is that working with the folks who are shelter staff or who work in shelters, kind of inspire that confidence with the vaccine. I think that's really, really important. We found that having the engagement sessions with staff before we had the engagement sessions with the shelter guests was very important. We also, by having people post why they got their vaccine on the big poster boards, and these were big poster boards, 4 foot by 8 foot boards that said, I got my coronavirus vaccine because, and like Luana said, we had Polaroid pictures and people would put their messages on those boards, and they were really pretty inspirational. I got my coronavirus vaccine for my grandbabies, for example, or I want us to get to herd immunity. It was pretty amazing to see what people had put, and those were almost kind of like vaccine ambassadors, because they were like testimonials for anybody to see. And those posters are still up in the shelters, in our shelter sites. So we are hoping that continues.
Excellent, thank you. And it's certainly a conversation now as we see cities and jurisdictions, even at the state level, starting to loosen some restrictions. One of the things that the HCH community is interested in is what is going to happen around returning to what life post-pandemic is going to look like, particularly in these shelter settings. You all did some really significant structural changes to some of your shelters. So this question may be for Christine. Has the city thought or making any steps towards having those conversations with their providers?
Yes, we actually sent out a survey a couple weeks ago to our shelter providers. One of the things that we found very important throughout this whole pandemic was having the voice of our providers at the table. So throughout the pandemic, we pulled together different shelter providers of different sizes and had focus groups and got their opinions on different steps or guidance that we may have gotten from CDPH. So we created a survey that went out to the shelter providers, asking them about their experience during this pandemic. What has changed? How has it impacted them? What have they learned? To get a better idea, because again, we need to figure out what our new normal is. We were able to receive, I don't have the exact number, but I think over 90–95% of our shelter providers responded. The deadline was last Friday, Luana, is that correct? And we should be getting those responses, the tallying of analyzing those responses, and the input from the surveys or the creation of the surveys. We talked to CDPH, Chicago Department of Public Health, as well as our healthcare partners on this panel as well, because we wanted to make sure we asked the right questions in order to, as we call it, recompress our system the correct way and see how it looks. So that's part of our conversation now, but we did create a survey. It's already gone out. We received the responses, and we'll be looking at the results and presenting them to not only CDPH, but Lawndale and Heartland as well.
Excellent, thank you. A question to you all. Was there any unexpected barriers? Although I don't know that we knew that anything was going to be expected in this, but any but unexpected barriers in particular that you felt like you collaborated with each other and with other city partners on to overcome in this process?
I think for me, and this is just one that stood out, we work so well with the shelter system because we not only fund as a city shelters, but also outreach, and we focus on the unsheltered. Because the city was on a lockdown, a stay-at-home order at some point, our unsheltered population was there without money because they would panhandle, some of them. They were without food. So we had to, once we figured this out, because we had outreach teams out asking questions, how are you, what's going on? We had to work with some of our partners to take additional food with Greater Chicago Food Depository and the Night Ministry and Salvation Army, who has mobile food vans or mobile vans that were able to take food to different locations so that they, because they still did not want to go into shelter, that they were not starving on the street. So that was one of the barriers that we did not expect, but it came up. And because our outreach teams were out there daily, they were able to pick up on that.
For Franciscan, I just wanted to mention, I'm sorry, Dr. Huggett, just one barrier that came about when the positivity rate of coronavirus positives came about. At that time, the isolation beds had decreased. And so it posed a huge barrier and difficulty for us to get a number of our clients to isolation. So that was pretty much the biggest barrier that was faced as it relates to us from a shelter standpoint.
Yeah, we remember that too well, don't we, Luana? I think that I think I can think of two things that from the hotel perspective, from the shielding perspective, that were a little bit unexpected. One was kind of part of the time that we were in, because we were trying to shield people within their hotel rooms under the public health, but then also certainly respect autonomy and try to achieve that balance of making sure that people were safe within their hotel rooms, but then realizing that people needed to take care of business, pick up their checks, just do what they need to do at the first of the month. We really needed to shift. We didn't allow, you can't smoke in your hotel room, so we had to institute smoking breaks. So that was a shift that we needed to. That was a shift that we needed to do. And one thing that we cannot ignore is, this was all in the midst of the murder of George Floyd. And we had to really, take care of, to discuss this, to acknowledge this, to acknowledge the stress that our staff and our guests at the hotel were under with the murder of George Floyd and what ensued. So that was something that, we could not have expected, certainly. And that was something that we kind of really had to deal with. And if I could just mention just one last thing, is that we've talked about the accelerated moving event and moving into housing and how that is great. But one thing that I think that we are finding is that just having your own place, your apartment, may not be everything that a person needs, that we really need to take into account a person's social needs, a social network, the supports that they need. I have patients that are coming back to the shelter from their apartment just to see their friends, because they are missing their friends. They're missing the social aspects of that. And I said, oh, what happened to your apartment? Is everything okay? Oh yeah, I got my apartment, but I'm missing my friends. So that whole part of how we can, really support the social networks of of the folks that we work with, people experiencing homelessness. I think that really needs to be addressed as we're moving forward, especially with housing.
What a wonderful point. For our last few minutes here, our last general question to you all, what bit of hope do you have, or what plans do you want to keep of things that have been working well, that you hope you carry with you in this post-pandemic world?
I'll answer that. This is Luana again. What I would hope and like to see, I think Christine mentioned earlier that during this whole pandemic ordeal, a lot of the shelters, particularly Franciscan Outreach, we went from an overnight program to a 24-hour operation. And so I would love, Christine, I would love to see that continue, because what ended up happening is the guests were able to increase case management services. We had better access to our guests because if they were leaving out of the building at 6 a.m., a lot of times they would scatter. And so being able to stay in the building, we have better access with our guests, increased case management services, more safety. We have like the local police and neighbors who are pretty much just working in collaboration with us, because guess what? We don't have our guests hanging out on the street, standing in line, hoping to get a bed. And so that's one thing that I would love to see continue to happen. And unfortunately, it came as a result of this pandemic, but there is a positive that's coming out of that. And so that is one thing that I will hope to see.
This is Mary. I would really like to see, as was mentioned, the shelter-based service team and the LCO work that both Heartland Alliance Health and Lawndale Christian Health Center are doing. I would really love to see that maintained. This has been, the job of a lifetime in a pandemic, of hopefully once in a lifetime. It's incredible collaboration to be able to work with DFSS and to CDPH and our shelter partners and Tom all the time, and really make improvement and move people into housing. It's amazing.
For me, and Luana, we currently in an RFP process. So when that application opens, we're encouraging all of our providers to put what the actual cost is. We've had level funding for the past several years, but what the actual cost is in regards to these operations. But just with Luana and what Mary stated, there's been so many lessons learned over the past year, and we just want to build off of that if we can. Just the collaboration with the healthcare providers, with the shelter providers. It's a great feeling to know that our homelessness positivity rate was low, because we were on it. We had people in place to address it, but just very grateful and just wanting to build on the lessons learned from this past year. So
that is wonderful. Well, I could talk to this group all afternoon. Unfortunately, we are nearing the end of our time, and I want to thank everyone for joining us. As I mentioned at the beginning, this webinar is the finale, and a wonderful finale that it was, grand indeed, as of a three-part series featuring these health centers. We had Washington, D.C., the state of Minnesota, and now Chicago. Recordings are available, and Barbara DePietro dropped this link into the chat. So this recording, as well as the slides, will also be available at this link. Generally, it takes us, hopefully by the beginning of next week, we've got our national conference coming up. So I'll lead right into that. We have our national conference coming up, so bear with our amazing media team of one, primarily Brandon, who is leading all of this. So he's got lots on his plate, but gets those available to you all. And as I mentioned, our conference and symposium will be virtual this year. It's coming up starting a week from this coming Monday on May 10th. The deadline for registering for the conference is Thursday, May 6th. So please, 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 we don't want to miss you. You all are what make it wonderful. And then finally, this amazing collaboration has come together. And the reason we wanted to feature these communities is we've had these amazing focus groups that have been sharing their experiences with us. We convey those to you all in our bi-weekly flash blast. So please sign up for those to receive. Those are lessons from the field, from those boots on the ground, as Luana perfectly started us off with. That is where we are learning what is the issues at the council. We elevate those, any opportunity that we get to our federal partners and and to make sure that they are heard. Thank you to my panelists. You are inspiring and amazing, and I am so grateful to have gotten to know you and to learn from you. And thank you all for attending. Be well. Have a good afternoon.